And so it's all about public education, about using DEET. Always like that. Use DEET, wear light clothing and wear long pants and tuck them into your socks. This is Canada. It's going to be, hopefully by next week, it's going to be 25 Celsius and humid. And damn it, the likelihood that I'm going to wear long pants is about 5%. Or maybe 3 per 100,000. I don't know. So we understand the habitats, but the key thing is that's not enough. The question really is, so what did you do when you thought you had a tick bite? So I remember having to review a file of a person who was wheelchair bound in a house and had a dog, and the health aide who was working in the house was bitten by a tick and was convinced they got Lyme disease that way. And as you know, dogs obviously have ticks, but there's no evidence that Lyme disease tends to spread from animals to humans, although you could theoretically be exposed to the ticks. That is very possible. But the reality in most cases is not this person was seronegative and was still absolutely convinced that they had Lyme disease, and in fact, because this happened on the job, they thought this was a workman's compensation case. They were very ticked when they didn't get the funding. So the habitats, of course, are going to be in tree-lined areas, grassy areas where ticks will be attached. Fall. Not surprising the human cases occur when we're outside. Shocking that we don't have a lot of tick-borne illness in January, February, March in Canada. But you can see that pattern of distribution is exactly when people are camping and going outdoors and hiking. And this is also important when you're trying to do an assessment of the patient, is if you find the tick and the patient has only been outdoors earlier that day or within 24 hours, the general consensus is that the likelihood of transmission of Lyme within 24 hours just doesn't happen. In fact, in most cases, under 48 hours is very low risk, as you can tell by this colored map. You're talking about less than 5%. So by and large, someone says, yes, they're outdoor yesterday, a treatment is not required, and we wouldn't even give the prophylaxis even if you found a tick for that reason. So that's why the history of when was the patient outdoors, when was the exposure, etc., is important, and preferably, did they find the tick, etc. And once an area has a well-established knowledge that the ticks are there, the health unit doesn't want to see any more ticks. But in areas where it's not well established, the recommendation is people bring in their ticks, send them in, because that's how we're knowing where the spread is actually taking place. And last year there was a new surveillance form that you guys have to fill out when you're sending in this stuff, just to let you know that everything's online.